Good afternoon, everybody. Today I'm announcing 23 new cases of COVID-19, bringing the total number of cases in Nova Scotia to 850. We currently have 11 individuals in hospital, 3 of those in intensive care. We have 392 people today who can be considered recovered from their COVID-19 infection. We now have 24,521 Nova Scotians who have been tested and have had negative results, which is really good news. We have 10 licensed long-term care facilities and an unlicensed seniors facilities with cases of COVID-19 involving a total of 189 residents and 82 staff. We continue to conduct more COVID-19 tests per capita than any other province in Canada. Yesterday, we processed 888 tests through the QE2 lab. And I want to stress again that early identification of cases is critically important. That's why we still have and will continue to have robust access to testing, lots of lab capacity. It's really important that any Nova Scotians who have symptoms that could be COVID, so that is if you have 2 or more of fever, new or worsening cough, a headache, sore throat, or stuffy nose, we want you to be tested. So if you have those symptoms or think you might have those symptoms, if you're able to go to 811 online assessment. If you don't have online capacity, calling 811, and you'll get further directions regarding testing from there. One of our cases reported yesterday was an individual who in one of our homeless shelters here in HRM. We became aware of that yesterday. Public Health responded. There was also a good response. We have a vulnerable populations team working in government across departments. They rapidly were able to find individual housing in a hotel for the people the rest of the people in the shelter who are considered contacts. They are being tested, and today we're putting together a comprehensive response plan for this individual and all their known contacts. We're looking at how we work with the homeless population in HRM, knowing that there's quite possibly COVID virus circulating through that population. Moving on, I want to recognize that Ramadan began last night and will continue until the evening of May the 23rd. This is an important religious celebration for many in our community. It's traditionally a time to gather. Many Muslims get together with family and friends for prayers and meals at the end of the day, and there's usually a big community feast to mark the end of Ramadan. Like so many other things right now, Ramadan will need to be different this year. No in-person gatherings or meals, but however, it remains an opportunity for strong connection and building community, even if that needs to be done virtually this year. So I would encourage all those who are celebrating Ramadan this year to see that as challenging as the pandemic is, there is hope in the future, and we will all recover this together. And I wish everyone celebrating Ramadan a blessed and peaceful time. Ramadan Mubarak. And as I said yesterday, as we enter the weekend, I want to repeat some of the things that I said yesterday. I talked about easy access to testing, and that remains an important part of our strategy, along with timely public health follow-up. Those together, in combination with the strong public health measures, are what we need to continue for at least a few more weeks. This does mean staying at home as much as possible, good and frequent hand washing, doing only essential shopping and other trips, and maintaining social distance of at least 6 feet from non-household members when you do need to be out and about, and also only getting together with family and friends virtually. Unless you are required to be self-isolating, we encourage people to get outside, to exercise, breathe the spring air. It will improve both our physical and our mental health. If you do so, please do that in your yard or in your local community and maintain social distance. Now is not the time to start going for drives out of your community to go hiking, ATV riding, or fishing in our great outdoors. I just want to remind people that provincial parks, beaches, and tourist attractions do remain closed. Some of our provincial trails remain open, but you should only use them if you can walk or ride your bike to them. In HRM, municipal parks and trails do remain closed. I understand that this seems harsh and is frustrating to some, but it's necessary to continue these strong measures for a few more weeks. We're not out of the woods yet. We need to prevent COVID-19 from gaining a foothold in Nova Scotia, to protect those most at risk for severe illness or even death. We need to do this to protect and respect healthcare workers and other essential workers as they continue to put themselves at possible risk while they serve us. And we need to do this to preserve our healthcare system so it's there when any of us may need it. I've talked about a lot of don'ts, so I'm going to talk about a few do's as well. Please do reach out and contact virtually someone in your community, especially someone who may be alone. Do mourn, honor, and remember, but do it virtually. Do help someone in your community who, because of age or illness, is more vulnerable to COVID-19 and needs to stay isolated. Do work with others to share essential shopping to reduce the number of people in grocery stores or pharmacies. And do be grateful for the many things that we have here in Nova Scotia. I ask all Nova Scotians to do these do's and don'ts as a way of caring for one another and a way of building up our communities. This has been a very difficult week for all Nova Scotians, and my heart remains heavy. The shocking violence of last weekend and the continued deaths of long-term care facility residents weighs heavily on me, as I know it does on you. Please know that it's okay, it's actually quite normal to be struggling with feelings and emotions at a time like this. It's also okay and important to let somebody know how you're feeling and to also allow yourself time to grieve. But also, please talk to a family member or friend and reach out for help if it's needed. There are lots of resources out there, and I would encourage people at novascotia.ca/mental health, and the mental health has a hyphen in it. There are a lot of links there to online and phone resources. I want to end by mentioning something from a video that was sent to me a short video that was sent to me a couple of nights ago that really struck with me, and it's called The Praise Song for the Pandemic. And the video ends with the words, "And when this has passed, may we say that love spread more quickly than any virus ever could." What if our love and caring for each other guides our collective response to COVID-19 and becomes the legacy that we all leave from this historic time? I'll leave you with that thought and wish everyone a safe weekend.